Thank you, ma'am. Thank you, IFSA. Am I pronouncing it correctly, ma'am? IFSA.
Yes, IWSA. Yes,
Yes,
right.
do correct me wherever, ma'am, needed. Huh?
Yes.
So, yeah. So, before even going to the topic, there is this disease, entire disease called TB. It comes under a group of diseases called as neglected tropical diseases. So, you see that it's been classified under a group which is clearly saying it's neglected. So neglected not just by terms of understanding what the disease is or how it spreads or what it causes, but also neglected at all levels. That is the reason why it is, though it has been, it is one of the most ancient bacteria that is still living in amongst us, but yet we are unable to kind of tackle it in a way that it has to be. So myself, ma'am, you had given a very brief overview of what does my experience both in terms of academic as well as professional. So let me not speak about that, but rather I would take this opportunity because my sincere interest would be to take away this TB disease from this group of neglected tropical diseases. Rather, it should be one of the diseases that we need to actually give the due focus that it deserves. So everyone, since it's a small group, a small request at the forefront. If there are any doubts or in terms of understanding what I'm saying or speaking, please do post it in the chat. Since it's a closed group, we can take as many number of questions that's going to come up. So I'm just sharing my screen, and once again, I thank IFSA and ma'am for this wonderful opportunity to speak about TB, so that it goes and reaches to those who actually need it. So without ado, I'll just go to the slides. Can anyone confirm, is it visible? Clear?
Yes, sir. Yes, sir.
Great, ma'am. Great, ma'am. Thanks for it.
Can you put it on full screen, sir?
I'm just putting it, ma'am. Just doing it. Is it clear now, ma'am?
Yes, yes.
Yeah, great. So yeah, is TB a public health problem in India? So this entire slide, the presentation would be a bit technical, but at the same time, it would also be in lay English, so that it'll help us understand the problem actually poses in our society right now. So I would be speaking about the public health expertise, which I can proudly say, after pandemic, many of the most of at least 70 to 80% of our country is well versed in many of the technical jargons related to public health. So more or less, we can proudly say that all of us have a public health expert inside us. Only thing is, we need to move from what we know and try to understand what we are yet to kind of come across. And that will be the first section that I'll be speaking of, followed by giving a glimpse of the actual epidemiological understanding about TB, which would actually equip most of us who are right now attending this lecture to go forward in case if you want to really address or give our contribution for TB. And next, we'll be going on to understand where we are right now. What is the level of commitment given by the country, and followed by what is the program right now aiming to do, followed by a key summary of what are the key actions that is expected from each one of us. So understanding. So this term, I don't think so, will be very much unfamiliar to all of us. We are more or less familiar with the term epidemiology, because the foremost question that one needs to focus on when we speak of any bacteria, or any virus, or any disease, why we need to understand it. That is the biggest question. So, for example, when I say the name COVID, since it's a small group, whatever things that are coming to your mind, let me just take a pause for 10 seconds. Can you just put it in the chat? When you hear the name COVID, can you just type whatever that comes to your mind and put it in the chat? I'll not take more than 10 seconds for this. A kind request to all the participants here. Since it is small, please let's have it participative. Whatever that comes to your mind when you hear the name COVID, from what it is or what it can cause, or so we already have at least 4 or 5 people answering. So I'll just directly go. So the first is highly contagious virus. Wash your hands. Could be fatal depending on the mutant. Fear of the unknown. Wow, great. Despite COVID causing all the havoc for the last 2 years, still we fear this unknown stuff. Great. So more or less, if we even ask the bigger population, whatever that comes to their mind when we speak of COVID, it's a virus. We generally speak about the symptoms and signs of the disease that it causes. How does it spread from one person to another person? Who are at a higher risk for getting the disease, and also who are at a higher risk of getting the complications from the disease? And what is the isolation period? That was one of the key debates that was happening in the last 2 years. How many were affected? And this is something that we all are right now aware of. How many people might have been affected with COVID disease during 1 week or the last month, or even let's say last 2 years or a year? And then how many people died due to the disease? And how can we prevent ourselves from the disease? And finally, about vaccination, which I was expecting, but still, maybe another 2 messages in the chat, which we'll go through at last. Similarly, let me take another question. I just want to ask another question. So whatever that comes to your mind when you hear the term diabetes, can you just put it in the chat? Just 10 seconds. Whatever that comes to your mind when you hear the term diabetes. You can definitely not go wrong in this, because whatever you say will be related to diabetes. At least we'll have a very distant link to diabetes. So yeah, let me just go to the chat. So insulin, excellent. It's a lifestyle disease, excellent. Metabolic disease, again, it's possible to control it, yes. Diet restrictions, great. Can be prevented by right way of living, great. Silent killer, sugar, inability to metabolize sugar, wow, great. So it's like all of you covered most of the things that generally comes to mind when we speak of diabetes. It's a non-communicable disease or a metabolic disease. It could be hereditary, and it increases blood glucose levels, and it can lead to all complications, silent killer, and insulin is needed for few, and tablets are to be taken lifelong despite controlling it, and lifestyle modifications are needed because it's a lifestyle disease. So how did all this happen? So when because many of you, I don't think so, you're all related to medical field, but still maybe affected by COVID, or you might have been affected, you might have been having, or you might be right now having diabetes. But still, how did all this happen? Despite the smaller crowd that we have right now here, the larger crowd which is there in the country, many of them would be aware of all this stuff, because people tend to talk. They tend to talk about the disease, both from how it originated to what and all it can lead to and how we can control them. And people do read about a lot of things, because many of the things that we right now know of diabetes and COVID, it's not just something that because we got affected by it or someone else whom we know got affected by the disease. It's because we also read across many books, pages, or news articles about COVID, about diabetes. And finally, whenever it comes to something of a greater nature, a problem, a public health problem, we took a general shared responsibility. It's not just a particular program or a particular division that was working on. For example, let's take COVID. So far in the last 3 years, it greatly wrecked the entire system. But still, there is not even a single dedicated program for COVID. However, we were able to manage the pandemic and we got through it, because it was a shared responsibility by each one of us, including the ministries and the government. The entire department, all the departments worked in line, in sync, so that we were able to overcome COVID pandemic. And finally, because we started reading more, because we started speaking more, and we took the shared responsibility, both the disease right now, whenever we say we got affected by it, or we are right now having it, the stigma that it had at the beginning is not at the same level that it has its importance right now. Because this the more we talk, the more we speak, the more responsibility that we take. The one important thing that goes away is stigma. So people are able to come out asking for help. People are able to come out and support people who need it. So this is one of the key important thing that happened. Though it was the entire pandemic and stuff that happened, it was all crisis the last 2-3 years. But one good thing that came out is that people are able to come out. People are now good in terms of reading about various medical events that is happening right now. Because of all this stuff, it's sort of a collective responsibility that everybody is trying to take responsibility in their hand. It's not, they're not just giving it to the particular department or the ministry that is right now working on for it. So all that we saw about COVID, what and all that you said, and what and all you said about diabetes that you know of, indirectly kind of qualifies you as an epidemiologist, because epidemiology can be defined as the study of distribution and determinants. So you right now, when you said about COVID and diabetes, you more or less summarized how it is distributed and what and all can lead to the disease and what and all can prevent the disease, and who are at a higher risk, that is in specified populations whom it is at a higher risk of affecting. And finally, what and all the learnings that you got, how can you apply this to control the problem, like lifestyle modification, like hand washing. So you were able to come out even with a solution based on the understanding. So in a nutshell, you're all epidemiologists when it comes to COVID and diabetes. However, to note here, COVID was a recent pandemic and diabetes was from recent past, because diabetes got its attention for the last 10 or 15 years to the maximum, before which even diabetes was not even unheard of, or it was not many of us were aware of diabetes. However, TB, can anyone say when exactly was this bacteria discovered? At least a rough guess, wild guess. Can people put it in the chat? When exactly was this bacteria discovered? Okay, now just go. So TB is not a virus. Just first thing to be clear, it's a bacterial disease caused by this bacterium called as Mycobacterium tuberculosis. And the great gentleman on the right side is Robert Koch. So he is the scientist who actually discovered the bacteria on March 24, 1882. So to say it was discovered at least 140 years before, more than a century back, it was discovered. And this day of March 24th is celebrated as the World TB Day for commemorating the Robert Koch's contribution to the entire world. So it is a disease of ancient past, at least for 140 years we know of, but also if you go back to ancient scripts, even from water mythology that we go back and refer to, there are certain descriptions which more or less mimic whatever that we speak of TB right now. And another basic thing that everybody needs to know is it can infect any part of the body. So it's not like COVID primarily affects the lungs. It primarily affects the lungs, TB, but still TB is a bacteria which can affect any part of your body, and it has a latent period. So that's the most dynamic part of this bacteria. In the sense, the bacteria once inside your body, it need not cause the disease. It takes its sweet time. It can either be cured by your immune system, or if you become vulnerable, it can come out as a full-blown disease. And approximately 10% of those people who get infected develop the disease in their lifetime. And the most common route of spread of the disease is similar to COVID, respiratory through droplets. And there is a definitive treatment available, unlike many other diseases, there is a definitive treatment available, and the success rate that the program right now, the overall country is seeing is more than 85%. And across the states, if we see, it is crossing even more than 95% in many of the states. And like COVID variants, this bacteria too has a variant. And that variant, we call it as drug-resistant TB. Because since it's a bacteria, the treatment of choice is an antibiotic. And over a period of time, if we keep on giving antibiotics, the bacteria has evolved and it is now having resistance. It is showing resistance to certain drugs that we right now have the standard of care. And the site of the disease, which I mentioned before, it can affect any part, but the most common 70 to 80% of the people who get infected have affected the problem in their lungs. Rest, it can also affect other parts of the body, like your voice box, larynx, lymph nodes, your brain, your spinal cord, kidneys, bones and joints. and it can also be there in your blood, which causes miliary TB and affect all the parts of your body. So literally to say, TB is a bacteria that can affect any part of your body. And most common signs and symptoms, we all know, but instead of going too much depth into this, I'll just briefly glance through the symptoms and signs. Most commonly, adults present with these sort of symptoms or signs. That is, they present with cough for more than 2 weeks or fever for more than 2 weeks. These symptoms need not be present altogether, either one or two, or just even hemoptysis for just once in the last week or last month. Even one episode of such thing also should also alert you that you may have TB. So immediately you should seek care. So the common symptoms for adults is cough for more than 2 weeks, fever for more than 2 weeks, and significant weight loss. Right now, what we are right now seeing in this era is people tend to diet and lose weight. But without even following any such sort of things, if there is weight loss that we are seeing, the most common suspicion goes for two diseases. One is diabetes, other one is cancer. But being a country which is having the highest burden of TB, people forget to think about TB. Do consider TB as one of the provisional diagnosis and seek appropriate care. Loss of weight is not just a manifestation of diabetes or cancer. It is also one of the most common symptoms that we are right now seeing for TB. And hemoptysis means blood in your sputum when you cough out. And when you're taking any chest X-ray, and if there is an abnormality in the chest X-ray, please do suspect TB. So these are the most common symptoms or signs for adults. When it comes to children, the same. However, for children, one important key difference is that if they tend to be a contact, or if at all they have come across as a contact with an infectious TB case, then immediately they should be screened for TB. So because children are at a very higher risk for developing the disease and contracting the infection. So if at all a child comes in contact with an infectious TB case, immediately he or she should be screened for TB signs and symptoms. And also a chest X-ray may be done, if not done before, to rule out the active TB disease. Because for children, the cough and fever may not be classical symptoms. Loss of weight and loss of appetite could be one of the symptoms with which they tend to manifest with. And finally, for extrapulmonary TB, depending on the organ that is being affected, appropriate symptoms tend to occur. So this is in a nutshell about how a person affected with TB could present with. Now let us actually go to the topic for discussion today. Let us try to understand the epidemiology of TB. On the left-hand side, we see a beautiful, confusing chart, which starts from A and ends with G, in the sense how a person with an infectious case coughs and throws the droplets out with the bacteria inside, and then the bacteria takes its course. It goes inside another person, infects, and then develop the disease, and our immune system reacts to the bacteria, and finally the person manifests symptoms of the disease. So this is a straight line. It's a pretty straight line that we are seeing, a closed circle. A person exposing, spreading the droplets, and then finally leading to another person getting the disease. This is in another way to put it, Newton's first law. So an object which is set in motion, that is a bacteria coming out, it is destined to infect another person, and it is destined to cause the disease in that person. However, this is one bacteria which is so dynamic, and it has evolved so much. I would say it has evolved even beyond our capacity and understanding. It need not cause the disease once it goes inside any human being's body. So if a bacteria goes in, generally what we see is that people get sore throat, people get cough. If, for example, if a person gets COVID, they tend to manifest some signs of the disease, and either the body cures that infection and the disease, or the person succumbs to the disease. However, this bacteria is so developed that it doesn't obey this general law which the other bacteria and viruses play. And let us try to understand why it does so. And before going to that, two important terms that all of us should be well aware of. And because this is something that people tend to confuse, and this confusion is leading to a lot of miscommunications. So to prevent such miscommunication and misunderstanding, even in this presentation, these two terms, please be aware. There are two different stages of the entire cascade. One is TB infection, other one is active TB. TB infection means a person is infected by the bacteria. However, the bacteria is not multiplying so much to cause damage to a particular organ, thereby leading to manifestation of symptoms. The bacteria is there in the body. It is lying dormant. It is not multiplying to the capacity that it has to cause the disease. So put it in a simpler way. To put it in a simpler way, that is, the bacteria is there in your body, but you're not manifesting any signs or symptoms, and thereby you're not able to get the diagnosis. So that is TB infection, putting it in a very, very simpler way. Whereas active TB means the bacteria is multiplying so much that it has caused damage, and the person is manifesting symptoms or signs, showing signs. So that is called as active TB. So let us try to be clear. There are two stages in the disease progression. First is TB infection. Second is active TB. And as it was said in the previous slide, not all the individuals with TB infection get the TB disease. Only 10% of them in their lifetime, they progress to active TB disease. Rest, either the body kills the bacteria, the immune system kills the bacteria and throws it away, or the bacteria is lying dormant and beyond the reach of the body's immune system. So this is one of the simplest epidemiological framework for TB, understanding TB, but it's still complex enough to delineate different compartments or the stages of progression and understand how risk factors or the determinants play in supporting the bacteria or enabling our body to fight at each stage. So this model has a prerequisite. So this entire framework has a prerequisite, that is, first a person should get exposed to the disease so that this entire model can work. Or to say it in a very simpler way, there should be an infectious case in the community so that he or she coughs out the droplets and the bacteria is entering another person. So the first prerequisite for any epidemiological model in terms of infectious disease is that there should be an infectious case. Followed by which the bacteria inside the host goes through different stages. But for each stage, the progression from each stage to another, there are multiple risk factors and determinants that play the key role. So one important point that I would be stressing in all the subsequent slides is that risk factors, determinants, risk factors, determinants. It is not the bacteria that is actually the killer. These are the determinants or the risk factors which are actually killing the people who are getting infected and who are getting the disease. So one thing we should all be having in our mind is that if at all there is a need, or if at all we need to eliminate this disease from our country, it is not the bacteria that we can eliminate, because we are not God. We can neither create nor destroy a particular species out of the world. The only thing that we need to eliminate is the determinant. Whatever the risk factors that we see as the increasing risk for getting the disease or getting very poorer outcome, that is something that we can eliminate because these are modifiable factors. So first things first. Is there any doubt? I can see someone speaking.
Please go ahead, sir.
Yeah, sorry. So yeah, is it still in the slideshow mode? Can anyone confirm?
We can see. No problem.
Yeah, great. I think so. I'm in the presenter view. So, as I said, there is an infectious case in the community. And once there is an infectious case in the community, the next thing that we expect is the person is coughing out or the person is sneezing, and there are droplets which are in the air with the bacteria inside. And then finally, these bacteria within the droplets goes and enters another person who is either in the same house or who is either in the same working place or is in any other setting where there is another person along with an infected case. So two important key determinants that lead to an exposure are, first, number of incident infectious cases in the community. There should be people affected by the disease so that they can spread to other people, to another person. And the second important key determinant is the duration of their infectiousness. The more the person is infectious, the more number of people he or she can transmit the disease to. So can anyone say what is the incidence of TB in our country? As per the recent global TB report, which got published last year, approximately annually, at least 1 crore people all around the world are developing TB disease, of which 28% to 30% are from India. To say at least 3 million individuals are affected with TB disease every year in India. This is not at all right, because if you go back and check for the same period, let us say 2021 or 2022, or let us even take 2020 when the pandemic struck, how many people actually got the disease, COVID? If you take, it would be even either comparable to TB or it would be lesser than TB in various months. Despite such problems, the attention that it actually needs is not being given. Because it is not, as I said before, it is neglected at various levels, because of which it is even classified under the group of neglected tropical diseases. This is the very starking picture which was published in the Global TB Report 2022. In terms of incidence, that is the number of people newly getting the disease in a year, we see that at least 2.9 million cases came from India, which approximates to 28% of the overall global burden. Second, in terms of the mortality or the deaths that we are seeing, at 1/3 of the deaths which is happening due to TB across the world is from India. To equate it to numbers, at least 5 lakh people, they die from TB in India every year. Third, as I said, there is another variant of TB that is upcoming, and the problem is rising, which is called as the drug-resistant form of TB. Again, 1/3 of the global drug-resistant TB burden is from India. To put it in another way, the entire burden, when we think of TB, the highest burden in the overall, the worldwide, is from India alone. So India alone is contributing to 1/3 of the global burden. And if at all the entire world should be free of TB, the one place where the TB bacteria or the TB disease should be eliminated is from India. If India can show that TB can be eliminated and we can end the pandemic or the epidemic that is going on silently, it means the world will be free of TB. This is a recent survey which got concluded last year, and it was the report was published. The National TB Prevalence Survey. It was a proud moment for all of us. And but the findings that came out of the survey were not that great, because the prevalence came to around 312 per lakh population, and it varied from 137 to 747 per lakh population. To equate it into absolute numbers, 312 per lakh population is more or less equal to 4.3 million, which is even higher than the global TB burden estimates which were published for 2021. And few other starking pictures which was published from the National TB Prevalence Survey. The report was that at least 63% of those people who are affected by the disease, they never sought care for the symptoms or signs that they are having. This was not at all right, and it was very glaring, because the first and foremost factor that we saw that leads to the exposure of the disease is that there should be a case. Another one is the duration of infectiousness.
नसों की तरफ से वो चल जाता, मालूम महसूस होना बंद हो जाता, फिर कोई भी चीज महसूस नहीं होती, ठंडा गर्म कुछ महसूस नहीं होता.
Can I, Lalita ma'am, is there whose mic is unmuted?
Yeah. I think Suparna, can you please
No,
mute?
we have muted it.
Yeah.
Great. So the first and foremost, the determinant for getting the exposure we saw was having an infectious case, and second, having the duration of infectiousness. That is, the more duration a person is infectious, the more number of people he or she spreads the disease to. And the duration of infectiousness, indirectly to say, that is, if I have the symptom and signs of TB disease, and if I do not seek care and get the diagnosis and thereby the treatment that it needs to be, that means I'm not getting the treatment and I'm transmitting the infection day by day from myself to multiple other individuals who come across and who come in contact to me. This was very starking, because 63% of those people who were affected by TB disease, they never sought care for the symptom or signs that they were having. And second starking picture that came out was 38% of those people who were affected by the disease, they never show the typical signs and symptoms, the table that we saw before. Cough for 2 weeks, fever for 2 weeks, hemoptysis, weight loss, loss of appetite and stuff. So even the symptomatology or the signs that the disease manifests as, even that has changed in the last 2 years, that people need not manifest with the specific cutoff criteria that is mentioned by the program. So these are the two important starting things that has come up, and which are not at all right. And that is why the program in the country, which I'll be speaking of in the last section, the program is now going towards something called as Jan Andolan, that is making the entire disease elimination in terms of TB elimination as a people's movement rather than the health ministry's agenda. Other risk factors which leads to an increased exposure to the bacilli: population density, family size, differences in climatic condition, age of sources of infection, gender. So various factors that are mentioned here, we can very clearly see India has a higher risk in whichever scenario that we fit ourselves into. Second, the problem is even more or higher in urban areas than in rural areas, because population density is something that is very high in urban areas, and that is something that is rising in India, and until 2050 we will be seeing this. And the family size, again, this is something that can actually put children and elderly at risk. However, there are no starking differences that we are seeing right now from urban to rural in terms of the disease and the family size, but still this is something that is very important, because if there are many people in the family along with an infected case, there is a chance of transmission from that person to the other infected other individuals in the family. And third, the differences in climatic conditions. So this mainly speaks for the Western countries. The one climatic condition which makes people stay indoors is winters. Fortunately, we do not have long winters in our country. And age of source of infection, it is a common notion that people tend to socialize with those of their own age group. And similar sort of epidemiologic picture that we see in India, it is more among the productive age group because they tend to socialize more. And the degree of social interactions also depends on gender to gender. So because of which even gender is also an important determinant for getting the exposure to the bacillus. But in a nutshell, the first prerequisite, just reiterating the point, the first prerequisite for any epidemic pertaining to TB should be, if at all that needs to be driven, the first and foremost is there should be enough cases in the community, which in India, we are the highest burden in the country. We have the highest burden in the entire world, and we have that. Second, the duration of infectiousness. Again, the prevalence survey has shown that 63% of people who have the disease are not seeking care for the symptoms or signs that the disease is manifesting. And 38% of those people with the disease do not manifest typical signs and symptoms. So it's high time. It's very clear that the most important driver of pandemic in our country pertaining to TB are these two, not any other drivers. Then going to the next step. The person got exposed. Now the bacteria has to establish the infection in the body. Before even going to the determinants, let me give you a picture of the burden of TB infection in the country. So the left half says that the prevalence of this TB infection in India is 31%. 31% equating it to numbers, it's very huge. 31% of the 130, let's say how many crores it would come to. So 130 million by 30% would come to at least 40-50 million would be the population would be having TB infection. However, the TB infection is also, it's not the same for all of us. The propensity to develop TB infection is not same for the general population. There are certain determinants that increases the risk of getting the infection. First and foremost is abnormality in terms of nutrition. That is, malnourishment is one of the key important driver even for getting the TB infection. Second is diabetes. It is not uncontrolled diabetes. Diabetics per se are at a higher risk of getting infection. Third, smoking. Smoking is one habit that is particularly damaging to lungs. The more number of cigarettes a person smokes per day, the more he or she is at risk of getting TB infection first place. Followed by alcohol. Alcohol again has an indirect effect on the nutrition of the individual, which in turn aggravates the risk towards getting the TB infection. And other risk factors that can lead to establishment of TB infection. As I said before, the first and foremost, for a successful transmission to happen, there should be a case which is infectious. And the only group of cases that can transmit from one individual to another are those people having the disease in the lungs. That is pulmonary TB. And the most common form of TB in India is pulmonary TB. To say 72% of the individuals with TB are having pulmonary TB in India. Second, airborne transmission. Similar to COVID, this is also something that spreads through air by in terms of the droplet nuclei that is coming out of the cough from one individual or the sneezing from one individual. So the factors that can curb the airborne transmission are the etiquettes, which all of us are aware post-pandemic. And the single and the most important factor that can curb the first step of getting the exposure and establishment of infection is people should get diagnosed early and they should be put on treatment. If a person with the disease is diagnosed early and put on treatment, by 2 weeks of treatment, at least 99% of the infectiousness goes away. To put it in simpler terms, if a person is getting diagnosed and the specific treatment is started, which is right now available across all districts, all blocks, and to say in all villages of the country, in the country, if we put them on treatment as early as possible, by 2 weeks of treatment, their infectiousness literally drops to zero. After 2 weeks, they can very well kind of do and be a part of the normal activities that they tend to do before. And fourth and foremost, air circulation and ventilation. Keeping the windows open, keeping the doors open. These are the things that we tend to follow post-pandemic. Before that also it was educated, but it didn't get the attention that it deserved. But now it is very common practice that we keep our windows and doors open if there is a person with respiratory symptoms. And important one, the immune response. So if your immunity is low because of various reasons, it could be because of a disease or it could be because of a particular treatment that you're taking, it posts you at a higher risk for getting the infection. Then, this is something people tend to confuse themselves with. A person is getting infected does not mean that the person is having the disease. Infection merely means that the bacteria is there in the body, but it has not caused severe damage to an extent that the person manifests symptoms or signs. So the bacteria is merely there in the body. It is not creating any problem. In the sense, it won't be transmitted from that person to another person. Only if there are symptoms, if there are manifestation, the transmission happens from that person to another person. And it was said before too, and reiterating for everyone's sake, approximately 10% of those people infected by TB infection progress to TB disease. And it's not like everybody progresses, only 10% progresses in their lifetime. And to say that this sort of a differential probability of progression, that means there should be certain factors which alters the entire pathway of this bacteria. So what are those factors? First is intrinsic. Intrinsic is something that we cannot change, but in intrinsic too, there is one particular factor which is gaining importance. That is body build. Gender, body build. Body build in the sense in terms of your BMI. Second, whatever that is there outside our body, in terms of the diet that we take, in terms of the nutritional status that we maintain, and most importantly, substance abuse. Finally, medical conditions that can put you at risk from getting the infection and developing the disease. HIV is something that is going low. It's declining in India. The incidence is declining. There's declined so much that we are near the stages of making India HIV free. Next, diabetes. Then on chemotherapy, immunosuppressive therapy, and past history of TB. To see all these three boxes, one thing that we can all say is that in India, the three boxes, the problems in terms of all the conditions in the three boxes, except HIV, everything is on the rise. And we also know that 30% of the population in India, they have TB infection. And if all these three problems are rising, the number of people who will be breaking down from infection to disease, you can expect what is going to happen in the coming days unless we take care of all these determinants. If all these determinants are not taken care of or managed properly, TB is going to be the next pandemic in the country, and also from India, it can go to other countries. The most common, the most high risk factors, if we see the top 5 factors that are leading the pandemic globally of TB. First is undernourishment. Second is HIV. Third is alcohol use disorders. Fourth is smoking. Fifth is diabetes. But in India, the top 5 factors that are leading the epidemic of TB. First is undernourishment. Second is alcohol disorders. Third is smoking. Fourth is diabetes. And finally, HIV. So if at all we need to focus on something towards, if at all we need to develop the thinking of eliminating TB or ending TB from the country, we need to first end undernourishment. We need to end the problem of alcohol use disorders. We need to end the problem of smoking. We need to end the problem of diabetes. If all these risk factors are not taken care of, these 5 risk factors poses a person at a risk of getting the exposure, poses a risk of getting the infection, and finally increases the risk from progressing to disease exponentially to multiple times. Finally, a person got the disease. The next thing that needs to happen is he should be diagnosed and put on treatment. If a person is diagnosed early and put on treatment, 2 things we get benefit out of are he will stop transmitting the disease from himself to others. Second, if he is diagnosed early and put on treatment early, his chances of getting a poorer outcome or his chances of dying from TB reduces to less than 5%. But what is happening in India? Let us see. The important factor that is driving the TB mortality in India is the timeliness of diagnosis. This is even corroborated by the National TB Prevalence Survey, where we saw that at least 60% or more than 60% of the people with the disease, they do not seek care. If you do not seek care, obviously there is a delay. And you know what is the average delay that the numbers are equating to? In India, on an average, a person of these people who had not sought care, in comparison to people who sought care, on an average, I'm mentioning only the lower confidence interval for the duration. It takes at least bare minimum of 6 months for a person with actual signs and symptoms of TB to go and seek the care for TB, which is very, again, it's a very sad state because this is something that we need to focus on. Reason being is that for 6 months, if a person is not getting the actual diagnosis or if the person is not taking care for the problem, 2 things happen. He keeps spreading the disease to others, both within the family, outside. Second thing that happens is he's putting his own, is putting himself at the risk of dying due to the disease. Because each and every day of delay that is happening, it's going to affect the outcome that he's going to get out of the disease. So this is something that needs to be focused on, because beyond which the program right now, something that is programmed right now focusing is something called as TB preventive therapy. Because it is very clear that we cannot close the leaks for eliminating TB disease. Just by closing the leaks, we are not going to eliminate TB disease. We need to close the tap. So the most important tap that we are trying to focus right now is by provision of preventive therapy. This is one of the recent advances globally, and even in the country, TB preventive therapy has been expanded to all the states and all the districts and villages. So that is what we are trying to focus on. But we can only provide preventive therapy to those people who seek care. If there is already a problem in seeking care, this is beyond the reach of the program. So how can we act now? We now have a majority of the stuff that we need to learn. We saw what are the determinants that leads to the exposure. Then the determinants which progresses from mere exposure to infection, then from infection to disease, and finally from the disease to death. So how can we act now? Since we have understood the state or the current state that we are in, we need to acknowledge that TB is a public health problem. Acknowledging that there is a problem is the first step towards finding a solution. That is something that is lacking in many domains. So we should acknowledge that TB is a public health problem in our country. Only if we acknowledge, we'll be able to brainstorm and plan what we can do to actually eliminate this problem. So that is something that all of you, whomsoever is there, you can spread it across and help in kind of doing the same brainstorming so that impactful intervention can be put in place. And once we brainstorm our ideas, we can implement them. So this is not the end, huh? This is not the end, huh? So let us go to a case of a country where TB mortality actually declined so well that the country is nearly TB free, but still there is a problem. But the country has, in mathematical context to put it, they have eliminated TB. This country is nothing but England. So let us see what happened in England and Wales from 1850 to 1950. So we are going at least a century back. Just to remind you all, TB bacteria was discovered by Robert Koch on 1882. And we are right now seeing the scenario of England and Wales, what happened from 1880 onwards to 1950. So we see that on the left side, we have the mortality rate from TB for males. On the right side, we have the mortality rate from TB for females. So there are two curves here. The lower curve is for 1891 to 1900. The upper curve is from 1851 to 60. So with around 40-50 years of difference, what is the scenario that they ended up? In 1851 to 60, if we can clearly see, the mortality rate both for males as well as for females, it was higher. For both males and females, we see that the mortality rate for TB was higher. Though there were few peaks, but still the mortality rate declined in 40-50 years. And this is a beautiful trend, the timeline graph. We see that from the beginning till 1900s, the mortality rate kept on declining in England. However, there was one peak during World War I and there was a small peak during World War II. But still, the decline in TB mortality in England continued. And here, we see that the first anti-TB drug, the antibiotic for managing TB, was discovered well after. It was discovered so late, but still there was a decline in England. We can clearly see here. So that led to the famous scientist Thomas Macion to brainstorm. So a similar sort of, he acknowledged that TB was a problem, but still what is happening in their society? Why is it declining? Because if something is declining, it could be because the system is not trying to show it, or it could be because something good is happening out somewhere, because of which TB is getting benefited from. So they started brainstorming it, and they tried to think in they had three set of ideas. The entire England sat together and they tried to brainstorm these ideas. Was it because of the preventive and curative therapy that we had discovered? They concluded that the bacteria was discovered in 1882. Pasteurization of milk started in 1922. And the chemotherapy actually for TB, a treatment for TB came up in 1947. And vaccination for TB in terms of BCG came up only in 1954. But already their mortality rate declined so much, they were going towards eliminating TB. So they ruled out that preventive therapy or curative therapy is not the one that closed the tap of TB problem in England. Second, they tried to think, had the bacteria changed? Had the bacteria become, is the bacteria become weaker now? Or is it because our immunity has gone so strong that we are able to fight the bacteria even if we get the infection? But we all know this sort of an understanding and theory to be proven, for this sort of a theory to be proven, that period was not because the science was not developed at that point of time, and we did not have, we still do not have all this necessary methodology or even equipments to prove this theory that the bacteria had gone weaker or our the immunity in our body has become stronger. So they ruled out that this balance is also not the reason. Finally, that led to them kind of compare various geographies within England, and they finally came up to the conclusion two things actually favored the decline in TB mortality. First is diet. With the Industrial Revolution coming in, the diet which every citizen of England had drastically improved. However, in the previous graphs, we saw there were two small peaks at the time of World War I and World War II. But the reason behind those two small peaks were that at the time of both World War I and World War II, there were severe shortages of food in England. And they concluded that it was diet, one of the key important factor that led to this decline in TB mortality in the overall society. Second, the conditions of exposure to the disease. We saw in the previous epidemiologic framework that for the disease to transmit, there should be a case. Second, there should be determinants of exposure and determinants of infection. All these determinants that we saw before actually improvised their ventilation, the etiquettes that they followed, and the living conditions that they were in. Everything improved so much during the Industrial Revolution that is also something that led to the indirect decline of TB mortality. So all this entire story of England tells us one thing. If at all we need to focus on eliminating TB, or if at all we need to do something, it is not just focusing on TB. It should be focusing on things beyond TB so that automatically TB will be benefiting. So where are we right now and what is the program focusing? And by now, most of us would either be confused or have good clarity on the distribution of TB disease. Second, the determinants for various stages and which population is at higher risk. And based on all this knowledge, how we can apply so that we can control this problem. So where are we? Globally, even today, as a single infectious disease agent, the topmost killer is TB. There is no other agent, single infectious agent, other than COVID that led to so much mortality. Second, in India, we see that post-pandemic, the last part of the graph, please try to focus on. These are interim estimates of India and they are subject to finalization, but still, which is something that we need to see is that this is something that we have not seen in the last decade, but still there is a small increase in the incidence that we are seeing after 2020, both for incidence as well as mortality. The number of people getting the disease as well as the number of people dying due to TB has slightly increased. Third, the recently concluded the drug resistance survey in the country also showed out of all the people getting newly diagnosed with TB, 2.8% of them were found to have drug resistant TB. To say that if a person is getting the TB disease for the first time in his lifetime, the chances of him having drug resistance is 2.8%. Second, if there was a previous history of TB, that is in his lifetime, if he already had been affected by TB disease once, in the next time, if at all he or she is getting the TB disease, the chances of him having the resistance was 11.6%. This is again a rising problem which is coming in the country. So now the country is having dual epidemic, both TB as well as drug-resistant TB. And how have we progressed in terms of ending TB? As per the Sustainable Development Goals, the timeline that has been fixed for various countries was 2030. However, India kind of committed that they'll be able to show this decline by 2025, 5 years ahead of the SDG timeline. In order to achieve that, let us say we have this incidence of so and so. We have committed that we will be declining the incidence as compared to 2015 by 80%. So right now, since we are in 2022 and we have still another 3 years ahead of us. So whatever the annual incidence decline that we can expect is bare minimum is 20%. So that we will go near 80% decline by 2025. However, the current rate of decline that we are seeing in India is 3%. And the required is bare minimum of 19%, so that by 2025, we will be able to achieve the SDG goal of 80% decline. And finally, I'll just sum it up with how the program has evolved. The program was launched way before. This was launched in the name of National TB Elimination Program, where the primary focus was using X-ray as a screening tool. Followed by which, after 3 years of the launch of National TB Program in India, globally TB was declared a global health emergency, like how COVID was declared 2 years before by WHO. Followed by which in 1997, the DOTS therapy or the directly observed treatment short course was introduced in the country. We know the treatment for TB is for 6 months. And even taking antibiotics for 5 days is a Herculean task for most of us. So considering 6 months of therapy, this directly absorbed treatment short course was launched in 1997. And it was upscaled to all the states and districts by 2005. And from NTP, the National TB Program, the program became National TB Control Program. Followed by which in 2012, there were like milestones. These are the programmatic milestones that was ever achieved. First is TB notification was made mandatory, both in the public as well as private sector. The reason being is that the programmatic guidelines has a set of public health action measures, and there are a set of things that the program provides to patients as well as the families of affected patients, including the preventive therapy, which we saw before. So in order to provide all those things by the program needs to know, the health ministry needs to know who are those who are affected by TB. So it was made mandatory, like how for COVID right now it's happening. Everybody's reports goes to the ICMR portal and they get notified. And rapid molecular testing, that is RT-PCR testing for TB, was introduced in 2012. Then active case finding. Then the program in 2012 to 17 only program thought, are all the people with the symptom and signs coming to the facility? No. It was shown that even at that point of time, 50% of those people with the problem never came to the facility. So this active case finding strategy was started in 2017. Active case finding in the sense, the entire health department actively goes to the community, door to door, and tries to find the case. And finally, in 2017, the big push came was integration. Integration in the sense, in order to close the tap, the program realized just merely putting people on treatment is not going to suffice. We need to integrate. Integrate in the sense, consider a person as a person, not a person affected with disease. So we need to improve the overall society. That is when we'll be able to eliminate TB. So integration of TB program with other programs in the National Health Mission, as well as in 2020, the program was renamed with a larger push as National TB Elimination Program. The reason being is that not merely integrating with other departments of the health is going to help. We need to make it as people's movement, so that if people come forward, there is definitely a chance to fight against this epidemic which is occurring right now in India. So 2020, the program got renamed to National TB Elimination Program, so that with a major focus on Jan Andolan. Jan Andolan in the sense, we are trying to create people's movement against TB. So let me not go much into this. What are the strategic, as per the strategic plan, what is the right program right now focusing on for the next 5 years? But this is something that I want to reiterate. The focus areas right now we are thinking about. First is decentralizing the molecular diagnostics. The program is pushing for decentralizing the molecular diagnostics to the grassroots village level, so that accessibility and availability is ensured. Second, health system integration. This is not a simple task, integrating. Integration is actually a change in the mindset, which is something that takes time, and we are right now into this. Third, collaboration. In order to close the tap of this epidemic of TB, we need to collaborate with all the sectors, all departments, so that a shared responsibility is there. So multi-sectoral action framework and the strategies are coming up. Finally, instead of TB-free society, now the concept that is changing at various high levels is that healthy village or TB-free village concept. So if we say some village or some geography as healthy, it means obviously indirectly that particular geography has attained TB-free status. And take-home messages. By this, I would have either created panic or sort of too much of confusion by showing a lot of graphs and table. We are right now aware, fully aware, scientifically aware about TB and its determinants. And most important message here is that if at all there is a problem, if there are symptoms or signs, even if not typical, please do seek care. Finally, who can play a role in this entire fight? It is our collective responsibility for the future with TB-free air. So it's not just a particular sector or a section. It is all of us. We have a key role in responsibility to solve this epidemic of TB. and various tools that are available. And this PPT, I'll be happy to share it. Please go through. And there is this particular app called as TB Arogya Sati. Please download it from Play Store. This is part of the ministry. So you can check yourself. This app will tell, based on the symptoms that you report, whether you may have TB or not. And accordingly, if you really need to know and get an appointment to a nearby facility, both in public or private sector, there are options available, and you can book an appointment and pay a visit. Get yourself diagnosed, screened, get yourself tested, and finally, if diagnosed, you'll be put on treatment. So, and other than that, if you need to enroll for certain courses related to TB, there is a WHO Country Office of India platform called as Swasthya Gurukul. You can very well register in that portal, log in, and there are a lot of self-learning courses and modules available with certificates. So please do enroll in your leisure time. Please do learn and get yourself certified too, so that you can spread this entire knowledge to beyond to other sectors. So thank you. Let us talk more about TB. Let us read more about TB. Let us spread the awareness straight away right now. Thank you.
Thank you, Dr. Raghavan, for a very, very informative and very interesting talk, which we really